Dr. Kevin Mangelson with the Center for Sleep Apnea and TMJ. So you've had a sleep study and you're kind of wondering, what are the key points or what do I need to know after my sleep study? I want to just cover briefly some of the key things that you should keep in mind or that you might want to be aware of after having a sleep study. When we look at a sleep study, we're looking at the entire night, and depending on whether your sleep study was done at home or in the hospital, there might be a big difference in the information available to you. However, most studies include a number that we call the AHI. AHI stands for Apnea Hypopnea Index. Again, let me break that a little further down. It's a combination of your apneas, which are complete blockages of your airway, hypopneas, which are partial blockages of your airway. And the reason we call it an index is because we actually break it down per hour. So they'll take the total events per night, divide that by the hours you sleep, so that we can kind of give you an hourly idea of how many respiratory issues or blockages that may be happening in your airway. That's a number you might want to look at. Typically, if your number is between 0 and 5, we consider that a normal finding. So if you had a sleep study and your number was less than 5, your provider probably informed you that you don't have sleep apnea. If your number is between 5 and 15, we consider that mild sleep apnea. 15 to 30 is considered moderate, and above 30 is considered severe. So just to put that number in perspective, let's say that you had a sleep study and your AHI was 15. What that means is, on average, 15 events an hour, meaning 15 times an hour, or once every about 4 minutes, your airway is being blocked. So either partially blocked with a hypopnea or completely blocked with an apnea, which is one of those complete blockages of the airway. That AHI is important to give us an idea of the severity of your sleep apnea, how frequently it's happening, and also what you may also be able to find in your sleep study, and almost every sleep study is going to provide you with an idea of your oxygen levels. So we want to keep a close eye to see what's happening with your oxygen at nighttime. Whether maybe you're keeping normal oxygen at nighttime, or you're having dips or reductions in the amount of oxygen available in your bloodstream at the nighttime. That can be important, and important to monitor as we find you treatment for that, to make sure that we're opening the airway so that your body is able to keep appropriate oxygen levels. Another thing that we're going to look at your sleep study is a positional component to your sleep apnea. Many people will find that when they lay down on their back that their sleep apnea is worse. And you may find that if you have a bed partner who reports, hey, you snore worse when you're on your back. That could be an indicator, and the sleep study will give us a clearer picture that your sleep apnea could be worse when you're on your back. It's something that we take into consideration when we look at treatment options for you and look at getting you the best care possible. Another part of a sleep study that could be important and that we may look at is your levels of sleep. We may look to see, did you spend much time in the deeper levels of sleep? How much time did you call into the REM sleep or restorative levels of sleep? And also, did you follow kind of a normal pattern of those deeper sleep levels? Some people with sleep apnea may find that because of those breathing events, and sometimes when they fall into those deeper levels, their sleep apnea gets worse, so the body doesn't allow them to fall into those deeper levels of sleep. Or if they do fall in those deeper levels of sleep, the body will almost kind of panic and release different things to wake them up so that they don't suffocate at nighttime or have those breathing episodes. So you'll find that your sleep study provides you with a whole bunch of information and gives you an idea of what's going on. It's really that sleep study that we use to tailor the best treatment options for you, whether that's CPAP, an oral appliance, a surgical option, or other options. If you have questions about your sleep study or think you might need a sleep study, please contact us at the Center for Sleep Apnea and TMJ. We would love to help you navigate getting a sleep study and finding appropriate treatment for you or for your loved ones. Thank you.